An EHR and an EMR vary greatly, although many use the terms EHR and EMR interchangeably. An EMR, electronic medical record, is a digital version of a chart with patient information stored in a computer, and an EHR, electronic health record, is a digital record of health information. Differences between EHR and EMR. EHR, electronic health records. EMR, electronic medical records, a digital record of health information, a digital version of a chart, streamlined sharing of updated, real-time information, not designed to be shared outside the individual practice, allows a patient's medical information to move with them. Patient record does not easily travel outside the practice. Access to tools that providers can use for decision-making, mainly used by providers for diagnosis and treatment. EMR, electronic medical record. Definition: the EMR or electronic medical record refers to everything you'd find in a paper chart, such as medical history, diagnoses, medications, immunization dates, allergies. While EMRs work well within a practice, they're limited because they don't easily travel outside the practice. In fact, the patient's medical record might even have to be printed out and mailed for another provider to see it. EHR, electronic health record. Definition: EHR or electronic health record, or digital records of health information. They contain all the information you'd find in a paper chart, and a lot more. EHRs include past medical history, vital signs, progress notes, diagnoses, medications, immunization dates, allergies, lab data and imaging reports. They can also contain other relevant information, such as insurance information, demographic data, and even data imported from personal wellness devices. The power of an EHR lies not only in the data it contains, but how it's shared. EHRs makes health information instantly accessible to authorized providers across practices and health organizations, helping to inform clinical decisions and coordinate care. An EHR can be shared with all clinicians and organizations involved in a patient's care, such as labs, specialists, imaging facilities, pharmacies, emergency facilities, and school and workplace clinics. An EHR is also necessary to meet meaningful use requirements. Meaningful Use is a Medicare and Medicaid program that supports the use of an EHR to improve patient care. To achieve meaningful use and avoid penalties on Medicare and Medicaid reimbursements, eligible providers must follow a set of criteria that serve as a roadmap for effectively using an EHR. An electronic health record (EHR) makes health information instantly accessible to authorized providers across practices and health organizations. It contains a patient's medical history, diagnoses, medications, treatment plans, immunization dates, allergies, radiology images, and lab results, among other medical information. EHRs are the future of healthcare because they provide critical data that informs clinical decisions, and they help coordinate care between all providers in the healthcare ecosystem. EHR versus EMR usage trends. While both EHR and EMR are commonly used terms, the term EHR, electronic health records, is now referenced more frequently. This is likely due to the Centers for Medicare. The CMS, when speaking of healthcare reform, always uses the terminology, meaningful use of an EHR. The ONC exclusively uses the terms EHR and electronic health records, explaining that the word health is more encompassing than the word medical. The term medical records implies clinician records for diagnosis and treatment, while the term health records more broadly denotes anything related to the general condition of the body. A personal health record known as PHR is just that, personal. It is those parts of the EMR, EHR that an individual person owns and controls. According to the 2014 Black Book Ranking Report, 31% of practices have adopted an EHR. A fully functional EHR system goes beyond basic functionalities such as clinical notes and documentation and incorporates more of your practice workflows. With a fully functional EHR, your practice is more seamlessly integrated with other members of the healthcare community, helping to improve coordination of care, increase patient participation in care, improve the quality of care, increase efficiencies and cost savings. EHR versus EMR. The advantages: EHR and EMR software systems have some disadvantages as well. Compared to paper records, a digital patient record (EHR) system can add information management tools to help providers provide better care by more efficiently organizing, interpreting, and reacting to data. EHR software can provide clinical reminder alerts, connect experts for healthcare decision support, and analyze aggregate data for both care management and research. The more interactive an EHR system is, the more it will prompt the user for additional information. This not only helps collect more data but also enhances their completeness. EHRs are the future of healthcare because they provide critical data that informs clinical decisions, and they help coordinate care between all providers in the healthcare ecosystem.